where they can have sessions with the clients as well, and not only the PA and the nurses there. Okay, thank you.
The third team, please.
Thank you very much. So, with regards to NOP, the first thing that we thought of is a very good collaboration with the district health management team, because you know the hubs, the health centers are within their scope. So if you get up, you want to do something without collaborating properly with the district director, it doesn't order well. So that the collaboration should really be there, so that if you need any support, he or she can also come in. So the first thing on anybody's list should be the collaboration. When you have that teamwork, everything will flow. Then the human resource. It's important to create a team. You, the family physician, cannot do it all by yourself. So you need to train your medical officers, other nurses, the team. It's a teamwork. So when you have that capacity building, you can take turns to visit the hubs. Otherwise, alone, you'll be going quarterly, but that wouldn't help much. So when you train your medical officers, other nurses, the team, you can put it on the duty roster. Let's say every week there's an MO who is supposed to go here. If you make it a regular something on a schedule, then the frequency of visits to the hubs will be better than quarterly. Meanwhile, you don't need to employ more MOs. Okay. Then the materials and the logistics. So from the hospital point of view, you need a vehicle, whether it's a car, motor, whatever. You need fuel to go. And at the spokes, the hub level, they need the basic logistics. There's FIG, thermometers, glucometers. They need the basic things, which unfortunately isn't really there for some. So this is one thing that maybe the authorities should look at. Then at the hub level, where we go for our assessment and supervision, they are supposed to also know their spokes. The PA at the hub level is supposed to know their spokes, so that they have a register and have a clear, train their spokes. Let's say, within a hub, the spokes, we have herbal homes, we have pharmacies, we have so many things within the spokes. So the PA at the hub is supposed to know the spokes very well and have a register and have a list of people that they expect to be coming from and update it from time to time, and have that relationship with the spokes at the PA level, at the hub. Then also we realize the need for telemedicine. You see, sometimes you cannot always get there, but a phone call or WhatsApp, a group, you can create a group, a platform where you can have this free flow communication and even referral discussion. You don't have to always be there in person. So telemedicine is something that we thought is very necessary. And as other people said, a checklist. We all need something to guide, and guidelines. Clear, simple guidelines that we can follow. Then somebody also mentioned compensation. Yes, incentive for the team who are going. So there's a reason why, if you have a good relationship and collaboration with your district director, you can easily ask for something for the people who are going. You have a schedule, so you tell them that, oh, this is a schedule, this is our plan, and they'll be happy. For NOP to happen regularly, they'll be very happy. So they will give the incentive. If they don't give, we will still go anyway, boss. Okay. Then, yes, the frequency, we were thinking of a monthly, let's say you are in a district, a municipality, you have 3 networks, 3 hubs. You can't go every week. So if you go monthly, let's say you go every week, but you go to Simpa, you go to Dumping, you go to, so like it will be like a monthly visit to them. Quarterly, I feel is too long. They will forget about you before you get there again. Then, yes, you see, most people don't even attend CHIPS compound and health centers in the first place because of no NHIS. So you can also get philanthropists. Whilst you are creating awareness, you are making your community entry. They know that, oh, you are doing this. They are happy because they know you are doing something for them. So when you create that awareness, you can collaborate and get philanthropists to also sponsor free NHIS registration from time to time. So when a lot more people have NHIS, they will attend the house. They will come. They will come to hospital so that your work will be easier. Then the last thing I have here is that when you go to the house, so authorities should also provide all the medicines, because when you go and do all the talking, you go and prescribe, and the medicines are not there, it comes back to zero. Thank you very much.
Thank you very much. I think there are a few things that I've run through. Is one, the monitoring, the visits. We're looking at if they could have something like on a schedule every Friday you are going for supervisory work. And the supervisory work, we're also looking at that, let's say they are running a chronic care clinic. Some of the clients that will be referred, if you look at the distance, they won't come. And there are a number of them. So why don't you, if you are going once a month to every facility, you go, you get there, you run the clinic with them. You build the capacity, they learn, and people know that you are coming from the big hostel, and almost all of them will come instead of each of them rather coming to the place, building that capacity. Of course, the logistics and the remuneration is cutting across, and we think that there should be clear lines. And if this could be incorporated into policy, I remember one thing was talking about the district director, his capacity to implement that is, but if it's actually incorporated into national policies, then we know that when you are there, it's part of your work that you are doing, and don't even have to go and see somebody to lobby before it is done. But all the information I've been taking, we'll put it together, we'll share, and hopefully we pray that these things will move on to improve the care. So I thank everybody here so much. I thank Dr. Efwa coming for flying all the way from Accra, and team Ayat from flying all the way to Accra to have this collaboration. And we hope that it can go far to improve the care in Ghana. Efwa, your last words.
Thank you very much, and thank you so much to the entire team. I'm just putting together my to-do lists. For starters, all the solutions are here, so no reinvention of wheels. But then we would need a few core people to help us to develop the package for our monitoring. It's essential that we can clearly define the budget lines, so that when we are budgeting for the things, we know that for a typical supervisory visit, this is how much we are proposing should go into it. The quarterly one within the NOPs, yes, we have all, so there's supposed to be a monitoring visit as part of the NOP supportive supervision visit, but we know quarterly, she just said the patient will even forget. Yes, so we are proposing a more frequent visit, and then a better remuneration, extremely important. So we have to include that as part of the benefit package. And then the other side is what we are discussing on the side, to look at alternative sources of funding. Let's see how we can also get other means to sort of trigger this thing to happen. We cannot continue to depend on the mainstream, and it takes forever. So there's a number of to-do things that we are going to ensure is done, but then we'll be coming back to you. All the key people are here. We already have our focal person, and all the team leads who presented should be part of the team to develop our package. So thank you very, very much, and then let's continue with the engagements.
Thank you very much. We'll be inviting her to Molly Park and to our awards and dinner night. I mean, we've been working together, and I always tell her that I've not seen any NCD team that has collaborated with technical teams and this thing like what we've had. And there's a lot of progress, and we pray that the progress will continue and we can affect healthcare in Ghana. We have a lot of sponsors, and we really appreciate them so much. AstraZeneca have been there from yesterday with me. We have Denk, we have Tridem, we have Symbiosis, we have Zipla, we have ESFA, all of them. I mean, I'll be, so no, oh, where's my, oh, my very good friend, No, the communication is not even Ghana, it's international as well. So we communicate with them in Ghana and in Nigeria. We appreciate them so much. I mean, it's there. I mean, if you see them and they come to a consulting room, give them a handshake because they've been supporting us and we continue to collaborate. But before we go to the next section, we want to ask, I think, Deng Farmer, for their presentation. Please, let's give them our attention as they give us the first presentation. And please, after that, we're going to have the two presenters for the science section. If they can come in front, kindly come in front. Those giving the first, Abna is here. Okay, so let's come in front so that right after that we can have our first scientific, our first over presentation.
Good morning. Thank you, Mr. MC. It is a privilege to once again be part of your conference.